Now for the next surgery which we'll be looking at, what is known as the ulnar shortening osteotomy. Ulnar shortening osteotomy. Okay, so look at this. Okay, so of course it's a surgery that is done on the ulnar bone. So the ulnar shortening osteotomy, just so you know, is a surgical procedure in which a small section of the ulnar bone, that's a forearm, is removed to shorten its length. Do you understand? So the cut bone ends are then fixed together with a plate or screw to allow healing. Okay, so why is it done? Of course, there are several reasons, you know. So most of the times is to treat what? Ulnar impaction syndrome. This is a condition where the ulna is longer than the radius, so it causes a lot of pressure on the wrist joint structures. Okay, so indications, other indications: if there's a lot of chronic ulnar sided wrist pains, you know, there's tears in the triangular fibrocartilage complex, or ulnar abutment syndrome, or maybe there was a failed, you try to use all those therapies, injections, but still there's a lot of pain there, you know. So procedure and overview is a section of the ulna is surgically removed, and the bone ends are realigned and stabilized with a metal plate and screws. See it? Okay, so over time the bone heals and the height or the length is now shorter. So the benefit is relieves the chronic pain that the patient was feeling, and there's now normal wrist mechanics, so the patient is able to use their hand like they used to use their hand. So you also prevent further damage to the cartilage and also the ligament. So risk complication, if it's not done properly, sometimes there's no healing. Then hardware irritation, the plates and the screws, sometimes they cause discomfort to the patient. And of course, for the time that you are healing, you won't be able to use your wrist like you used to use your wrist. And there's a big wound, so if neatness or hygiene is not practiced, there's a risk of you having infections after that particular surgeries.